Hello, and welcome to your injection training. By the end of this video, you'll learn how to safely inject yourself with Tirzepatide. In your injection kit, you'll find a vial that looks something like this. Unwrap the top of the vial to prepare for use. In your kit, you'll find an alcohol prep pad. Unwrap this prep pad and disinfect the top of the vial. Now it's time to prepare the syringe. In order to avoid air bubbles, pull 10 units of air into the syringe. Push the syringe into the top of the vial and inject the vial with the 10 units of air. Your dose of Tirzepatide is 2.5 milligrams, you'll pull 25 units. If your dose of Tirzepatide is 5 milligrams, you'll pull 50 units. If your dose of Tirzepatide is 7.5 milligrams, you'll pull 75 units. If your dose of Tirzepatide is 10 milligrams, you'll pull 50 units. Now it's time to inject. Gently flick your syringe to dissipate any air bubbles that might have been drawn up in the process. Disinfect the area you're going to inject with an alcohol prep pad. Pinch the area you're going to inject and gently glide the needle in. To dispense the medication, pull the plunger down. Gently remove the needle. As a reminder, be sure to refrigerate your medication once you're done.